On this episode, we'll talk about if exercise can really stall your weight loss. We'll talk about the difference between a regular sleeve and a mini sleeve or needlescopic sleeve. And we'll talk about, can you really feel hungry after surgery? Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 246. Wow. I mean, it really flies. Thanks so much for being here. And if you are new to the show, don't forget to subscribe to our channel. That way you won't miss on future videos, because we upload videos on topics like gastric sleeve, like weight loss surgery, like weight loss in general, absolutely every single week. So don't miss out. And you're more than welcome to send me your questions, because this show is about you. It's about you sending me your questions using the hashtag. Don't forget to use the hashtag, otherwise we can't get to those questions. Use the hashtag AskDrA, either on the comments down below or throughout social media. We're able to grab those questions, add them here to the show, and more than happy to, by the way. So let's get into the show. All right, so the first question is, can exercise really stall my weight loss? So I started exercising, I don't see the scale moving. Is this common? The answer is yes, definitely expected to stall your weight loss. And there's several factors. Number one is you start exercising, you did not exercise, you started exercising, and just by starting to exercise, you can expect to be sore, and that soreness is inflammation. That soreness is your body is retaining some fluids. That soreness is, it's a lot of factors that is promoting muscle growth, and that muscle growth means weight. You're increasing your mass, your muscle mass, while with the surgery, you're decreasing your stored fat. That is the ideal scenario. That is what we really want. That is why we push patients toward protein intake and exercise and weight resistance, because we want you to lose from the stored fat and protect or preserve your muscle, or even increase your muscle. So you're losing the fat, but you're increasing the muscle, and pretty much stalls. What should you do? Is, I tell patients all the time, you got to keep going. You got to trust the process. You got to keep doing the exercise, even though the scale's not moving. That's fine. Don't focus on that number. All right. I know, yes, we want to make that scale move, but your body's transforming. Your body's changing, because you're increasing your muscle growth. You're decreasing the amount of fat in your body, and physically it shows, even though that number down on the scale isn't showing that much. So you need to trust the process, keep on going, because sooner or later, if you keep on going, that number is going to move in your favor. Trust the process. All right, and on this week's questions, they were asking, because we had several cases this week, they were asking about the difference between a regular sleeve and a mini sleeve, or also called needlescopic sleeve. So inside is exactly the same technique. It is exactly the same procedure. Don't think because you hear the term mini sleeve or needlescopic sleeve, or you're getting less of percentage of stomach cut out on the procedure. No, it's actually the same thing. It's just the instruments, which are mini, they're much smaller. To give you an example, if we use 3 incisions that are 5 millimeters in diameter at the time of procedure, with the mini sleeve or needlescopic sleeve, we use instruments that are 3 millimeters. I mean, we don't even stitch them up. We just put a steri-strip on. If you want to know more precisely about this, I have a video dedicated on this topic, and we'll link it down below. Last question is a very good question. It's a very common question. Is, I just had my procedure and I'm feeling hungry. Wait a minute. Wasn't the procedure designed to cut my hunger, to to diminish my hunger, to lower my hunger. I was doing this procedure. I wanted to get this procedure because of that. What's going on? Because I feel hungry right after surgery. Well, the thing is, it is completely normal. It is completely common. And no, you are not weird, because this is a very common scenario. So imagine getting your procedure just a few days ago. In the procedure, we manipulate inside. We reduce the stomach size. We cut. We staple. We suture. All the manipulation inside, and all that produces inflammation. Believe me, the sleeve, the next 24, 48 hours, 72 hours, the sleeve flares up. I mean, your new stomach flares up. It is completely swollen, very swollen, all right, because of all this manipulation that was carried out during your surgery. All this inflammation and swollen tissue, your brain detects that as hunger. Even though you're not hungry, that inflammation is like, something's going on. I need something to put that fire out. It really is that fire is inflammation. So it is completely normal. Trust the process again, because down the road, as the swollen tissue comes down, that hunger goes away. Because remember, with the gastric sleeve, there is a chunk of stomach, there is a piece of stomach that we remove, and in that portion, specifically on the fundus, the upper part of the stomach, where ghrelin is produced in a good amount. Ghrelin is also produced in other parts of the stomach and the small intestine, etc. But ghrelin produces head hunger, and that portion we remove at the time of procedure, but you won't feel the effect right away, all right? Because right away, what you're feeling is the inflammation. Your brain's like, put the fire out, I'm hungry. What's going on? Well, if you trust the process and the inflammation goes down, the swollen tissue goes down the road, hunger vanishes and it lowers greatly, all right? And that is when you are feeling the effect of the procedure. Not right away, because right away, you're going to through the recovery phase. Once you're done recovering from this, and for the rest of your life, you will have or take advantage of the gastric sleeve. All right, so there you have it. By the way, on that last question, feeling hungry right after surgery, I also have a video, a complete video that talks about that, and we'll also link it down below. All right, send me your questions. Please send me your questions. I need your questions for this show. So remember just to add the hashtag AskDrA. It could be here on the comments down below here on YouTube. Add the hashtag, and or throughout social media. Don't forget to smash that subscribe button. That way we can hang out again. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve, yes, one sleeve at a time. Take care and God bless.